So when you injure yourself, you actually develop a stuck flow of pain. And that thing is stuck in a joint and a muscle in an area of the body. So what I'm going to do is I'm going to demonstrate that on someone in the room who has like a real chronic pain that just is there for a long time and won't go away. You do?
Yes.
What do you have?
Trigger finger.
Okay, does it hurt? Because that's a little different.
Yeah, it does.
Okay, hurt right now?
Yes.
Okay, good, come up here. So a trigger finger is a little scar tissue that develops on the tendons that gets stuck there and you can't move it, yeah. Okay, so we'll have you stand right here. Come a little closer, good. Okay, so you have, where's the pain?
It's here.
Okay, so now the first thing, did you have an injury there or it just happened?
I think it developed from carpal tunnel.
Carpal tunnel, okay. So what happens is like it's hard to extend it or it kind of gets stuck there sometimes? Yes. Okay, and it hurts? Okay,
Yes.
all right. So now, we're going to have someone fix it. Here she goes, come up here. And that way I can kind of walk everyone through it. Right, let's come over here. So you stand right over here. So you're going to be the practitioner, you're going to be the patient.
Yes.
Okay, you're going to be the doctor, the patient.
Oh, I get to be a doctor.
Yes, you do. And so here's the thing. How many of you have seen any of the videos on pain that I've done? Anyone? Okay. How many have never saw these videos? Okay. This is going to kind of blow you away because this is very, very different. Every single technique that we're going to teach you, every single procedure works on the principle of opposites. So the way we're going to fix this pain is to trigger the opposite side of the body. How many have never heard that before? Okay. When you first hear it, it's kind of like, what? That's weird. How could you do that? Well, believe me, it works. You can just relax your arm. Now, why would it work? Why would working on the opposite point be more effective getting rid of pain than working on the same side? Because you have all these circuits, these connections. And guess what? This side of the body is connected to this side on an electrical circuit. When you step on a dog's tail, he barks through his mouth, right? So the hip bone's connected to the thigh bone's connected to... So it's all connected. That allows you to walk. I'm just trying to break it down. So when you walk, you don't walk like this. Sometimes you do. Sometimes you walk and you synchronate your left and right side of your body. Every time, if someone pushes me forward, this foot's going to go forward. Like, well, how did that do that? Because the left and right and the front and back is all connected to all these little circuits. So you have electrical wires that go from this finger to this finger, and that allows you to pick things up and coordinate and support and open things up. So that's how it works. Very complex circuitry. It's like the body's like a machine. So what we can do is we can stimulate the exact opposite side of the body, okay, to get rid of the pain point. Now this works it works fast. And no one does this. They don't teach us in school. So that's what I'm teaching you. You're going to be quite amazed. Now, the thing is, what's interesting about this is that when you work on the opposite side, it'll be twice as tender on the good side. Only when you press. So apparently, the energy kind of builds up on the other side, especially if it's chronic. But this won't hurt normally unless you press on it. So how do we know we're on the right spot? Look for the point that hurts twice as much. And they'll go, what the heck? I didn't know that hurt. So when she presses that point, what's happening is we are resetting the electrical circuit of basically working on the brain. We're kind of teaching the brain to turn off its electrical signals. And some of you are going to say, oh, Dr. Berg, if I stepped on your toe, of course you're going to feel better. And no, that's not how it works. It's not going to work. So let's just, the first thing you do is we're going to rate her pain, 10 being very severe, 0 being no pain. How would you rate it?
10.
10, right now.
Really?
Okay. So now we're going to take this hand, go ahead and take it, and then have her point to where it hurts.
What hurts on that side? This one?
Yes.
Can you, wait, get the exact spot. No, let her point to it.
Oh,
Okay, good. So now where would be the opposite point on that? Wait.
Actually, actually, it would be.
It's right here, okay? Because you have to think in opposites. Okay, so now you're going to take this hand, take your thumb, and kind of work that out. Okay? And dig in there pretty good. See if you can find it. You're going to tell her if it's tender or not.
Is that tender?
Yeah.
Okay? So now I'm just going to do it just to make sure that it's... Okay, you can relax the hand with the other hand. Yeah. So I'm going to press in here. Okay, you see her eyes? So you want to feel around a little more firmly to find the exact epicenter. So it's like right through in here. Okay, go ahead and find that, and then right here. Okay, press in there a little bit more firmly, and you tell her if it's the same pressure.
It's not.
Go a little harder. Come a little bit more this way.
Yeah. Up a little bit.
Up. Good.
Right
Yeah.
there.
Is that it? Okay, just kind of work that a little bit. Work that for about an hour. No, it's good. No. So we're just kind of, right now, we're sending circulation down to the side that she has a loss of communication right there.
I can feel it.
You can feel it?
Yeah.
Okay. So now, how long did that take us? Probably maybe 5 seconds or something? So just ease off there and just give me a number on that side. It was a 10.
About a 7 now.
Okay. Now, did it move in location?
It was going in a circular motion.
Okay. Where's the pain now?
It's still here,
But
but it's
the
not
same?
as severe.
Right, it's less. Okay, good. So what I'm going to do, just to speed this up, so we're just going to
He knows better.
press in here a little bit more. So you kind of point a little bit lower. So you see how I'm just kind of going in there a little bit, and you want to just rub it a little bit on an irregular basis, just to kind of send the signals in there a little bit.
Okay. Oh,
Can you feel the difference?
yeah.
Well, she's going to feel pain right now until I stop, but I'm just kind of, now you don't want to press too hard. I'm just kind of going in there a little bit just to kind of ease up some of the pain through there. And I'm watching her eyeballs so they don't pop out. You don't want to create too much trauma in there, but
Oh my gosh.
Can you feel the difference?
I feel
okay. Okay, now let's just see what that is now.
it's came down to.
A 2, okay. Did it move in location?
It came down 2 from 7. So
Okay, that's 5. Okay. All right, did it move in location or is it still in the same spot?
It moved
Okay, where? Point to it.
down here.
So you see what's happening? It's changing. See what happens, it won't completely erase until you get the exact point. But since it's kind of a broad thing, sometimes you have to narrow it down. So we come a little bit lower and we just kind of work right through this point.
I can see your eyes.
Is that too painful?
It hurts, but yeah, but it feels so good on this side.
Okay, good. Good. It's like a good hurt. Okay. So you definitely want to apologize for the pain that I'm
Yes.
putting her into. I'm really sorry about that. And okay, so now, so let's just see what it is
I
now.
see your eyes.
Woo. 3.
What, 3? Okay, I like that. Now, did it move in location?
It came further down.
Okay, so go ahead and take it and work down. Just kind of work down that finger. You use some,
I do some pressure.
yeah, just go in there
I mean,
and kind of
I'm small, you know.
Okay.
I don't have that kind of pain. Okay.
stay on that, yeah, like right through in here. So basically, very simply, we're pressing on the mirror image side. Okay.
It does.
Now we could probably do this for maybe 10 minutes and completely get rid of that pain. How long have you had that for?
About 2 years, but I've been going back and forth to get cortisone shots.
Yeah. So cortisone shots are anti-inflammatories. Cortisone is an adrenal hormone, and they come with a package because it'll mess up your own adrenals. So it'll temporarily work, probably just come back worse.
Yeah, it lasts, the shot will last about 6 to 8 months. And the last time I had one was last year around this time. And I
Yeah.
actually have an appointment to see a chiropractor on Monday.
Okay, if you have any pain left when we're done with you today.
Right.
Um,
Oh my gosh, it feels a lot better.
Wow.
better.
So you did it. Good job.
A lot better.
So what, give me a number. Is like, what is it? How would you rate it now?
It's about a three.
Wow.
But it's gone down from
Yes.
10.
Wow.
Yeah.
All right. So let's give her a good job on that one. Yeah. Yeah. So good job. So thanks for coming up.
You're welcome.
You're welcome.
Thank you.
You're welcome. Hey guys, thank you so much for watching. Please click the subscribe button and I will see you in the next video.